Hi, I'm Vicki Mansavege. I'm the Chief Executive Officer for New Life Medical, and our focus is regenerative medicine. We are an FDA licensed and multi-state registered tissue bank located in Florida, and our goal is to educate the community on the benefits of regenerative medicine. Regenerative medicine is when your body can heal itself. But as we age, if you think about it, if you were young and you cut your finger, 2-3 days later it heals. But as you get older, especially baby boomers such as myself, when you cut yourself, it takes longer to heal. Well, through medical technology and new techniques, we have components now that can help your body enhance that natural ability to heal. And that is all through regenerative medicine.
So tell us, what is your official explanation of stem cells?
I think that stem cells are the holy grail of medicine at this time in our lives and with the aging population that we have. However, what people are not aware of is there is so much more to regenerative medicine than just stem cells. A lot of people have stem cells taken from their own body through taking a piece of bone out of their hip or fat from their belly area usually. But if you are 50, 60, or even older, your stem cells are as old as you are. So might not work that well. So again, through modern technology, we have found a way to take not only stem cell, but all of the components that help the body's natural ability to heal from birth tissue. And when you say that, people are, no, but what we do is we take them from very healthy, carefully screened mothers at the time of a cesarean section. And what we're able to process is something that would normally be discarded. And that's taken from the placenta, the umbilical cord, even the amniotic fluid. So in addition to stem cell, which some of these products have, some don't, you have things like cytokines, and those are anti-inflammatories, collagens, which give you that youthful appearance, proteins, hyaluronic acids, which if you have any type of an arthritis or pain, is a healing process. You need to have that hyaluronic acid. So when you say regenerative medicine, you talk so much more than stem cells because there are so many components involved to make this as effective as it is. What are the benefits of regenerative medicine for older people? I won't say such as myself, but we want to enhance or slow down the aging process. We want to look younger. We want to feel younger. We don't want the aches and pains. So regenerative medicine can be used in many specialties. I'll start with pain management. Imagine if you were 65 years old, severe arthritis or a lot of trouble with your knee, and they told you needed a total knee replacement. A lot of people don't want to do that. Our goal is to prolong or prevent that need for a surgical procedure. So through a simple injection of any of the components I discussed earlier, we can eliminate that pain. We can help with the inflammation, and we can help with the healing process. For aesthetics or cosmetics, we can give a more youthful appearance to the face. Very simple injections. We can stimulate hair growth. We can, help men that might have different disorders, everything from erectile dysfunction to male enhancement. These types of products are used in surgeries to promote the healing process, to expedite the recovery time. Conditions such as spine, a lot of people have lower back pain. It's painful when they turn. Through regenerative medicine therapy, you may enhance that healing process to eliminate that pain, or if not eliminate it altogether, reduce it significantly. For wound care. In this country with the diet that we eat, there's an issue with diabetes. A lot of people get things as diabetic foot ulcers or ulcers in other areas. Through amniotic birth tissue, you can expedite that healing process through a simple injection. foot surgeries, ankle surgeries. You know, we have many professional athletes. Their goal, their responsibility is to be on that field, be it baseball, football, rugby, polo, soccer, whatever it may be. They do not want to go through a surgical procedure. They have contractual agreements. So hopefully with these regenerative medicine therapies, we can reduce that recovery time and again prevent or prolong the need for a surgical application. Yes, when people hear of birth tissue being used in medicine, it makes some of them uneasy. It's very important to know that these are very healthy mothers that go through an extensive, not only medical screening, but social screening as well. And they are tested for every communicable disease. These are very healthy, carefully screened mothers that are tested for communicable diseases such as hepatitis, any type of carcinoma or cancer, actually obviously the HIV virus. All of this is done prior to the delivery. You have a technician there at the time of the scheduled cesarean section. This causes absolutely no harm to the mother or to the newborn. At that point, it's taken to a CLIA certified laboratory where it's processed and it goes into quarantine for clinical use. Prior to releasing that, there's destructive testing done, and what that means is they take a portion of the finished product and they destroy it for additional testing to make sure that nothing was picked up along the way. We have had thousands of people treated with regenerative medicine with no adverse reactions, which is a very positive thing. When these products are used, or when birth tissues are used for things such as aesthetics, hair restoration, pain management, to enhance males, it's very little downtime. The whole procedure normally takes anywhere from 15 to 20 minutes. It's a simple injection. There's no limits or limited activity afterwards. You resume normal activity. You can't go out and run a marathon or lift 200 pounds, but you can go back to your normal lifestyle. And that's what makes regenerative medicine so popular today. With our busy lifestyles, with our limited time, we want to feel better, we want to look better in the fastest time possible. New Life Medical is, as I said before, a licensed tissue bank that I run. I have been in this industry for 30 years. And when I started in this industry, there were no regulatory agencies, there were no, the American Association of Tissue Bank. It was really a learn as you go type of process. 30 years ago, we move up to today. Science has escalated tremendously in this field, and we are realizing the magnitude of what our bodies can do. So prior to that, you would have organ donors or organ recipients, musculoskeletal tissue, which is your bone. You would have those types of recipients and donors as well, who altruistically donate the gift of life. We would always look at the future for regenerative medicine. That was always the goal to work for. Well, the future is now. We are here, and while we have millenniums of time to go expanding this, we are at an area now where we can work with you, work with our physicians, work with the scientists, and continue to do research that will enable you to live the life you were meant to live, without pain, without or slowing down the aging process, and feeling good about yourself, feeling good healthy, feeling good internally, and just our goal is to enhance your life. That's what we are about.